Hello and welcome to the NABCA webinar, Changing Alcohol Use in Emergency Room Visits. Before I introduce our speaker, Dr. Aaron White, I wanted to address a few housekeeping notes. The webinar is one of a series of several planned through 2019. Another webinar addressing the federal trade practice rules and regulations relevant to the brewing industry is planned for September with the Alcohol and Tobacco Tax and Trade Bureau. Now back to today's webinar. It will be about 1 hour. If you have a question, please type it in the chat window in the lower right-hand corner of the screen. At the end of the presentation, I will come back and ask the question on behalf of Dr. White to address them. The presentation is being recorded and will be available through the NABCA.org website within 7 to 10 business days. You will find it under the Resources tab. I'd now like to introduce Dr. Aaron White. Dr. White is the Senior Scientific Advisor to the Director at the National Institute on Alcohol Abuse and Alcoholism. His areas of scientific expertise include the impact of alcohol and other drugs on brain function and behavior, alcohol-induced memory blackouts, epidemiology of alcohol and other drugs, and prevention strategies. Dr. White received his PhD in biological psychology from Miami University in Ohio in 1999. His graduate research focused on the brain mechanisms underlying alcohol-induced memory blackouts. He completed a 2-year postdoctoral fellowship in the Department of Psychiatry at Duke University Medical Center in 2001, and then served as a research assistant professor in the department until 2008. He co-wrote the online alcohol prevention course, Alcohol EDU, which has been completed by several million high school and college students to date. He joined NIAAA in 2008 and served as the Program Director for Underage and College Drinking Research in the Division of Epidemiology and Prevention Research until 2015. Since then, he has served as a Senior Scientific Advisor to the Director, Dr. George Koob. Dr. White is an author of more than 60 manuscripts and book chapters, as well as 3 books, 2 of which are about adolescent development, and has delivered hundreds of presentations about alcohol in the brain to diverse audiences. Dr. White, I now turn the webinar over to you.
Okay, thank you, Cassie. Hey, everybody, this is Aaron White at NIAAA. I'm so glad that you're all joining us today. I have about an hour of your time. I'd like to spend about 40 minutes giving you an update about all things alcohol and then leave time for questions. So what I'd like to accomplish today is to basically give you an overview of where things stand regarding the epidemiology of alcohol use, how many people are drinking, how much they're drinking, how many people have alcohol use disorders. I want to talk about some very interesting trends with regard to alcohol, particularly with regard to alcohol in women. We're learning a lot about alcohol in women's health, and I want to talk about some of the interesting things that are happening in that domain. And then, of course, I'll talk a little bit about how alcohol interacts with opioids. I think it's important to understand just how common alcohol plays a role in opioid overdose deaths and why that occurs. So you'll see in the slides that I'll show you, there's tons of data. I'm not going to go through all of the statistics, but because you'll have these slides, I wanted you to have all of the stats in case you ever want to go back and use them as a reference. So briefly, there we go. So here's a snapshot from the National Survey on Drug Use and Health from 2017 to give you a sense of just how much people are drinking in the US. About 52% of the population 12 and older drinks each month. And about half of those people engage in binge drinking, which, as you know, is defined as having 4 or more drinks in a night if you're a woman, or 5 or more drinks in a night if you're a man. And so, you know, about half the population 12 or older drinks and half of them binge. Interestingly, if you look at drinkers and you ask the question, what percentage of drinkers drink what percentage of alcohol, it turns out about 10% of drinkers drink the majority of the alcohol, over 60%, and about 10% of drinkers account for the majority of alcohol use disorder cases. Again, about 60%. And so it's lots of people drink in the U.S. The problems are generally concentrated in a relatively small percentage of those people who do drink. Again, more numbers, about 14.5 million people in the US have an alcohol use disorder. And really, an alcohol use disorder essentially means that you're drinking in a way that it's causing problems in your life, but you continue to drink and you have difficulty cutting down or stopping. And more or less, you're stuck in a cycle. Where you drink to intoxication, it wears off and you feel bad, and then you start thinking about when you can drink again, and then you just repeat the cycle. That's about 1 in 20 people in the US aged 12 and older. As I'll show you in a minute, emergency department visits related to alcohol are increasing, and you've got about 5 million cases a year where somebody shows up at an emergency department and the reason they're there involves alcohol. It might not be due to alcohol. It could be that your leg is broken, but you also were drinking and you fell because you were drinking, so the alcohol contributes. The number of deaths in the US is an interesting statistic. We don't really know how many people die from alcohol in the US. The most common number you'll hear is 88,424, and that comes from an analysis done by the CDC using data from death certificates between 2006 and 2010, and then they make assumptions about the contribution of alcohol to deaths from other things and add those in. For instance, I think 15% of deaths from epilepsy are considered to be alcohol involved. If you look at death certificates only, it's about 70,000 deaths a year. But we really just don't have a handle on how many deaths alcohol contributes to. It's at least 70,000, probably much more than that. Similarly with the cost, I mean, we can estimate the cost, but we don't know for sure. But the CDC estimates the cost at about $249 billion a year, and the majority of that, I think it's like 75%, is due to workplace-related things, lost productivity in particular. So a lot of people drink. We've got a lot of people who struggle with their drinking. Quite a few people die every year, and it's expensive for the country. So alcohol use is increasing in the U.S. If we look at data from several surveys, this is a study. These data are from a study in which the authors included data from 6 national surveys and just threw it all into analyses and came out with an estimate that included all of those data sets. And this is a very busy slide, but I want to highlight something for you if I can do that with this fancy technology. There we go. So what you'll see is this line right here. This is the percentage of people in the US that drink in a given year, and you can see that it is increasing, but it's not really changing for men. Most of the increase in alcohol use in the US has been driven by women. Similarly, if you look at binge drinking in the past year, there's an increase among adults in the US between 2000 and 2015 is roughly the year time range. But again, it's really not increasing for men. Most of it is an increase and for women. The biggest increases in drinking in the last 15 years have been among women, older people, particularly the baby boomer generation, and African American men. And you can see that over here in this table. So that sort of sets the stage to tell you, the prevalence of drinking and sort of where things are moving. Okay. So this slide shows again changes in alcohol use in women relative to men, and I like this slide because I think it captures the phenomenon nicely. What's happening is, as you'll see on the left there, that's alcohol use in the past 30 days, and the top line is males, and the bottom line is females. And basically, what you see is that alcohol use among males has declined just a little bit in the past, 30 days in this time period, but it increases for women. And if you look at the number of days per month that people drink, it's coming down a little bit for men and it's increasing for women. And so all of this combined is leading to what is being referred to as narrowing gender gaps in alcohol use. Essentially, Men are decreasing a little bit and women are increasing. This is for adults. And this is troubling, and I'll tell you why it's troubling in a moment. But that's what's happening. There's really been a real increase in alcohol use for women and a decline, or a relatively flat line for males. Okay. This slide, let me explain this to you. I really wanted to include this even though it's very busy, but this is a neat slide. What the World Health Organization did was they plotted in this graph the ratio of alcohol use for women and men in various countries across the planet. And what you see where that arrow is pointing to the US, it is close to, get my pointer back here. This line here means there's an equal distribution of alcohol use for men and women. So when a country is close to this line, it means that men and women are roughly similar in their alcohol use. And the United States is getting closer and closer to this line. And it seems that it's only a matter of time before we end up on that line. And we have an equal level of use between men and women the way we're going. And this is a new development for us because historically, going back to Prohibition time, men drank way more than women. And most of the problems associated with alcohol came from drinking by men. And over the last century in the US and across the world, actually, those drinking patterns have narrowed. And now men and women are much more similar than they ever have been. And with that comes an increase in consequences for women. And so this slide shows data regarding the number of visits to an emergency room each year that are alcohol related between 2006 and 2014. And it just, without going through each of those lines, basically it's gone up. It's been about a 62% increase in the number of alcohol-related ED visits between 2006 and 2014, and that ends up being about a 50% increase in the rate of those visits. The visits are increasing faster for women and for older drinkers, including people in the baby boomer generation. So the increases in drinking that we're seeing are mapping on to the increases in harms that we're seeing. There is some good news in all of this, and that is that alcohol use by teens is coming down. Alcohol use in the underage category, 12 to 20 overall, is coming down. This shows you 8th, 10th, and 12th graders from the Monitoring the Future study, and what you can see is in this age range, I'm sorry, in this range of time, a 10-year period between 2008 and 2018, there was about a third decline, in about a 33% decline in alcohol use among our students, which is great news. Now, interestingly, just like with adults, there's narrowing gender gaps, but it's a different pattern. Whereas with adults, drinking is coming down among males and going up among women. Among our adolescents, drinking is coming down among both males and females, but it's not coming down near as fast among women among girls as it is among young males. And so, as you can see here, if we use this over here is the percent of 12th graders who engaged in binge drinking in the last 2 weeks. You can see that starting in 1975, there was males were about twice as likely to do that. And now in 2016 here, males and females are just about even. And the same thing with drinking on a daily basis. Males have really plummeted, and females have just not really, they've gone down, but just not nearly as much. And so again, for both adults and for adolescents, there are these narrowing gender gaps, but for slightly different reasons. I'll tell you this, it is good news, but it's not the best possible news, because as I'll show you, while drinking is declining among our kids, there might be some psychosocial reasons for that are not particularly healthy. Our kids are isolating more, they're not spending as much time socializing or being around other people, and that means they have less fewer opportunities to drink, but it also means that they're not getting their needs met in healthy ways through socializing. And with that is coming an increase in anxiety and depression among these kids. So the decline in drinking is good news, but it's not necessarily because they're all so happy and healthy that they just have chosen not to drink. There are other things going on here. So there's one of the reasons that this is so concerning to us, these changes in alcohol use by women, adult women and adolescent females, is that we're simultaneously learning about some of the negative effects that alcohol has on women that are different than men. Women just seem to be, for some reason that we just don't know, more likely to manifest a variety of alcohol-related problems than males. Now, as you all know, the male and female body is different in important ways that affect how alcohol impacts the body. If you take a male and a female of the same weight, females tend to have less water in the body. They tend to store more fat and have less free-flowing water. And that means with every drink you have, even if a woman weighs the same as a man, every drink she has is going to produce a slightly higher blood alcohol level than in the male. That means even if you drink the same amount and weigh the same, you're bathing your body tissues in more alcohol. So that might contribute to, and probably does contribute to, some of these negative outcomes. But I can't explain many of them. For instance, for whatever reason, females tend to be more susceptible to hangovers. And this even happens if you do lab studies where you put the alcohol into the veins. So you're giving exactly the same, you're arriving at exactly the same blood alcohol level in the male and female. The female the next day has worse hangover symptoms. Females are more likely to black out, memory blackouts. Liver disease progresses more quickly in women. Brain atrophy progresses more quickly. Cognitive deficits. The cardiovascular effects of alcohol progress more quickly in women. AUD progresses more quickly in women. These are all phenomenon that fall under the category of what's been called telescoping, where women just, once a problem develops, it develops more quickly. And then certain cancers. You've all heard the news, the research over the last couple of years suggesting that women might be at elevated risk of breast cancer, even with a glass of wine a day. And of course, all of that research is still ongoing, and the jury is still out about exactly where the risk begins and how big the risk is. But it is concerning to us. So I want to explore something with you that I think you'll appreciate once we get through it, and that is, I want to talk about why it is that people drink alcohol. And then come back to these sex differences. But why is it that we drink alcohol? Why is it that people do any recreational drug? Well, there's two basic reasons. One is to produce a positive state, because it feels good, basically. And that's referred to as positive reinforcement. And that's generally what we think about when we think about people using alcohol and other drugs. We tend to think, oh, people do drugs because they want to feel good. They want to get high. They want to, have euphoria. And some people do. And I've got some ads in here just to sort of capture the motivation that people have to drink to do substances. So experiments and pleasure. Many people drink or do other drugs to feel pleasure. Some people, or maybe the same person at a different time, does substances to fix a negative state, to basically feel better, not to add euphoria, add to your pleasure, but to fix feeling bad. Now, it turns out that your motivation for drinking or doing other drugs, whether it's for positive reinforcement or negative reinforcement, is prognostic. It tells us something about where your relationship with this drug may go in the future. And specifically, people who drink or do other drugs to cope or for negative reinforcement are much more likely to develop problems with a substance. And so, people who drink to enhance or for positive reinforcement, they might drink more heavily when they drink, but they tend to drink less often. Whereas people who drink to cope tend to drink less heavily, but more often, and it's sort of a slow grind toward an alcohol use disorder as they try to cope with their problems with alcohol and tolerance develops to the alcohol, so they have to drink more, and they end up locked in a cycle where if they stop drinking, they feel much worse than when they started, and so they keep coming back. And so these motives are important for predicting the likelihood of certain kinds of alcohol-related harms. And it turns out that several studies in the last few years, including this one that just came out, suggest that females beginning in adolescence are more likely to be drawn to alcohol for the negative reinforcement. So to cope with social anxiety or stress, to basically for coping motives, whereas young males are more likely to engage in this sort of stereotypical alcohol use that we think of when we think of young people. They go out and party. They drink a lot in an evening, and certainly they can suffer all kinds of harms from that. But drinking for negative reinforcement increases the likelihood that over time somebody will develop a serious problem with alcohol. And so we're learning a lot about how when you enter adolescence at age 10, your brains are basically the same, or very similar. But when we leave the end of adolescence, we come out of the second decade of life, our brains are wired in important ways that are different between males and females. And for some reason, the female brain sort of creates a scenario where negative reinforcement from alcohol or other drugs is more valued than it is in males. This is a statistical phenomenon. It's not every woman or man. It's it's a statistical phenomenon, but women are just more likely to be drawn to alcohol for those coping motives, and that is concerning, given what we know about what those coping motives predict. And it's also concerning given that if we go back to our adolescent sample, it turns out that over the last 10 years or so, there's been a very big increase in emotional distress among our kids. For instance, these data show a 37% increase in kids who report who had a major depressive episode in the past year. And as you can see in the graph, the increase has been bigger, much bigger for females than males, and females already have a higher likelihood of having issues with anxiety and depression than males. So this concerns us because while we're seeing declines in drinking among teens, the declines are much bigger for boys than for girls. And we know that there's been this increase in anxiety and depression among kids, particularly among females relative to boys. And we know that all of that can set our young girls up for drinking for negative reinforcement and then developing problems as a result. So we could end up in a situation where fewer young women are drinking, but more of them end up developing problems as a result of the increases in depression and anxiety, which would give rise to drinking motives that are designed to help cope. So this has already been shown with marijuana. This is a study that came out just this year, looking at reasons why teens give for smoking marijuana. And what you see is that in this very busy slide is that the percentage of teens who say they smoke marijuana to cope has gone up significantly over time. And so again, if this happens with alcohol, we may end up seeing an increase in the prevalence of alcohol use disorder among young people, even as the percentage of teens who drink comes down. Okay, let me switch gears a little bit here and talk for a few minutes about alcohol and overdose. I mean, so I've been focused a lot more on alcohol and chronic drinking and developing an alcohol use disorder. I want to talk about acute intoxication with alcohol and the dangers that it poses. And in essence, alcohol has a narrow, what we call therapeutic index. The therapeutic index is a ratio of the toxic dose of a drug for half of people over the effective dose for about half of people. And you want that to be a big number. You want your toxic dose to be way higher than your effective dose. You want to go into CVS, buy aspirin, go to your car, take 3, and know that you're probably not going to die. You want that toxic dose to be so much higher than the effective dose that you have a safe window for error. And it turns out that with alcohol and opioids, as we'll see, the therapeutic index is fairly small. The toxic dose is not that much bigger than the effective dose. So if we consider that a 0.05 BAC would be sort of an effective dose if people are looking for relaxation, or that's about what moderate consumption would produce for a male at 2 drinks. The toxic dose for humans, where about half of people would die, seems to be around 0.35. And as you can see on the right side, there are lots of, these are all young people, college students who've died, and you can see the range of their estimated BACs at the time of death. And so you've got a therapeutic index of about 7, which means that if you accidentally drank 7 times more than the dose that you normally drink to get the effect you want, you could die. That's frightening because it is possible to do that, and it does happen. I mean, if you're drinking out of a big red cup that somebody's pouring spirits into, you could very easily get close to that level or beyond. So alcohol can do that, and the way that alcohol does it is by shutting down these what we call vital reflex centers in the brainstem. Let me show you that in a minute. So obviously opioids have narrow safety margins too, particularly with the new synthetics that are coming out. Fentanyl, those jars show you the amount of the drug that it would take to kill you, and you can see in the fentanyl container, I mean, you're looking at a couple specks. Well, there's something that's whatever it is, 500 times stronger than that that has been synthesized, and so it doesn't take much of this to kill you. So the therapeutic index is going to be very small with these drugs. So alcohol combined with these drugs is going to shrink the safety margin even further. And it doesn't take a lot of alcohol, as I'll show you. This is just a slide showing you the sort of evolution of the opioid crisis. And I want to point out to you that an estimated 399,000 people died from opioid overdoses in this 18-year period, and about 1 million people died from alcohol at least. And so, yes, this is a major crisis. But let's remember, alcohol itself can kill and does kill lots of people in the United States. The combination of the two is particularly deadly. And so what this slide shows you is on the right-hand side, you see some brain stuff, and what this is here is the brain stem, the very base of the brain. You can see it here, and it's blown up. That's the base of your brain, right near the bottom of your skull. This is about where the bottom of your skull would be, and then the rest is spinal cord. Well, these are very primitive areas, and what these brain areas do is they keep you alive. Something's got to keep your heart beating. Something's got to keep you breathing. Something's got to make sure that you clear your airway if something is blocking it. These are the same sorts of circuits that also help you sneeze and cough. They're just vital to our lives, vital reflex centers. Well, alcohol can shut them off, and opioids shut them off, and the combination of the two shut them off even easier. And so, you have too much of the drug and suddenly you stop breathing, or you can't clear the airway when something blocks it. That's what these drugs can do at high enough levels. And I want to show you the outcome of a fascinating study that used fairly low doses of these two to show that you don't need much. This is frightening. All right, let me find my. There we go. Okay, so researchers did a study where they took a dozen young adults, a dozen elderly people, and they gave them 20 milligrams of oxycodone, which is a pretty good dose of oxycodone. It would be for, I would imagine, moderate pain, moderate to severe pain, and they measured their ventilation, their breathing, and then they gave them alcohol, the equivalent of basically like a drink or two, in their veins over an hour. And just that amount of alcohol, just a drink or two combined with that 20 milligrams of oxycodone, caused a significant depression in breathing and respiration. All told, it's almost a 50% decline and the rate of breathing, of exchanging the gases in your lungs. So the opioid reduced it by 28%, alcohol added another 19%. That is frightening. People in the study had, I think I'm going to pronounce it wrong, apneic events. They had events where they literally stopped breathing and had to catch themselves and start breathing. It just doesn't take much. So we think that the estimate for how often alcohol contributes to opioid overdose deaths is way underestimated. The death certificates list alcohol in about 20% of opioid overdose deaths. But given that we know that it doesn't take a lot of alcohol to compound the problem with brainstem suppression, we suspect that that alcohol is far more commonly involved in these overdose deaths. Okay. One of the things that we're working on here at the Institute is finding better ways to connect people to treatment, because one of the major barriers to getting help is that people just don't know what to do. They don't know where to go. And so we created something called the Treatment Navigator, which is now online, that helps people evaluate what the treatment options are and figure out what to do and where to go. We have another resource called Rethinking Drinking, which basically helps people evaluate their drinking and decide if they need help. So the combination of Rethinking Drinking and this new Treatment Navigator, we hope will help people first evaluate whether they need help, and then how to get help. Or you could work on this with a loved one or for a loved one. But very few people get treatment. Of that 15 million people a year with an alcohol use disorder, fewer than 1 in 10 people get any kind of treatment at all in a year. And so, we think that we can improve that by just working harder at connecting people with the treatment they need. If we do that, and we can catch alcohol use disorders earlier and get people help earlier, we can minimize a lot of the harm that occurs in their lives and also reduce the burden to society of alcohol use disorder. So that's one of the things we're really focused on here. Let's see. So to summarize, alcohol use, including binge drinking and alcohol-related ED visits, are increasing in the U.S., particularly among women and older drinkers. And by the way, as the baby boomer generation ages, even if the percentage of people in that age group who have an alcohol use disorder doesn't go up, let's say it just stays the same, because that age group, the size is about to double in the next 30 years, we're going to have a much bigger burden on society from alcohol use in that age group, simply because of the sheer increase in size of that age group. Again, even if the prevalence of drinking and alcohol use disorder doesn't change. Underage drinking is declining, but it's declining much more for males than females. By the way, it's declining at college too. I don't know if now it's statistically declining among college age young adults, but college used to be a place where students drank a lot more than people outside of the college environment, and that is going away. Young adults are just in general sort of merging in terms of their drinking, which is interesting. So women are more likely to, underage drinking is declining, but more for males and females. And I want to come back to the point that there's something going on with kids where anxiety and depression is increasing, isolation is increasing, socializing is decreasing, and alcohol use is decreasing. And our concern is that among those kids who do drink, more of them will be drinking for negative reinforcement, and that could lead to an actual increase in alcohol use disorder at the same time that drinking is coming down. Women are more likely to experience a variety of alcohol-related health effects, and research suggests that males are, again, statistically more likely to drink for positive reinforcement, while females are statistically more likely to be motivated by negative reinforcement, and drinking to cope or for that negative reinforcement doesn't bode well, because it sets up a cycle where the alcohol temporarily fixes the problem, but when it wears off, you feel worse, so you drink again, and it temporarily fixes the problem, and at the end of a year, your problem is worse. For instance, in a study of college students female college students who say they drink for anxiety reduction, if they do daily diaries over a year, you find out that at the end of the year, their drinking escalated and their anxiety got worse. It just isn't a solution. It's more of a trap. And we know that alcohol and opioids are a deadly combination, and we're pretty certain that the number of opioid overdose cases that involve alcohol is probably much higher than the statistics suggest, simply because you don't need a lot of alcohol to compound the problem that opioids produce in terms of brainstem function. Okay, I think I just got through that in record time. So that's my contact information. You are totally, absolutely welcome to call me, email me if you have any questions. I'll provide any resources I can, point you in the right direction if I can't. Thanks.
Thank you, Dr. White, and I can vouch personally, having reached out to Dr. White on numerous occasions, he's very prompt in his response, so I do encourage you to take him up on that offer. So with that, we're going to turn it over to the questions that have populated throughout the presentation. The first one is from Pamela. The question is, has anyone done an analysis of how alcohol costs impact an individual citizen, such as how they contribute to increased health insurance or local taxes for law enforcement?
Oh, yeah, I'm sure that has been done. I mean, they're estimates. Yeah, I don't know those numbers off the top of my head, but I think the CDC has done that, and they provide estimates for the cost to a given individual. And if not, that's something that I can do the math and just given what I already have and tell you those answers. So I would ask the person that asked that question if you would please reach out to me when we're offline, and I will provide more.
Thank you. We have a question for clarification. I believe it was on slide number 3, which is just noting on the last slide, I believe that there was a total cost in millions, not billions. So just can you clarify that point for us?
Yeah, thank you. That's just me not knowing how to do basic math, I guess. Yeah, you're right. Those are billions. Those are not millions. I'm going to fix that.
Excellent. Okay, thank you.
Thank you for pointing that out.
Another question comes from Elizabeth. Did you mean the jury is still out about the extent of the connection between alcohol use and cancer? I thought we knew from years of research that there is a clear connection between alcohol use and cancer, and then notes a citation from CDC, cancer, alcohol.
Oh yeah, no, I think that's very clear. I mean, we've known for years that alcohol is a causal agent in cancer. It's considered a carcinogen by the government. It is. There's no question about it. What the jury is out about is just the amount of alcohol required to do that, and for whom and why. We know that it happens. We know that from epidemiological research that the increase seems to occur for women at even less than 1 drink, the increase in risk for breast cancer. But with epidemiological studies, you're always estimating based on self-report and records, and so it's just, I don't think we know for certain where the thresholds are. And why and for whom. But we do know, I don't think there's any question at all, that alcohol is a cancer-causing agent, including breast cancer, and primarily cancers of the head and neck and throat, but also breast cancer and esophageal cancer and stomach cancer. I mean, it is a cancer-causing agent.
Thank you for clarifying that.
Mm-hmm.
The next question comes from Claire. Do you think that there could potentially be a stigma for males to admit to a major depressive episode, and this could possibly go undiagnosed? Could this potentially skew the data, even in regards to the reasons for drinking and differences between gender?
Oh, that's a great question. Yeah, I mean, there's always that possibility. I mean, even with something like hangovers, maybe women are just more likely to, acknowledge that they don't feel well. I mean, who knows? So that is certainly possible. And but I have to assume that the people that do that kind of research take that into consideration somehow. And when it comes to epidemiological data, we again, we only have what we have to go on. We only have self-report and records, and there's always confounds. There's always things that contribute to the variance. Whether that's sufficient to explain away the differences between males and females, and the increases in anxiety and depression among females, and the increased likelihood of a co-occurring disorder, mental health disorder, depression or anxiety disorder, and alcohol use disorder in females. Whether differences in how males and females, what they tell us, whether that can explain away the difference, I doubt it. But again, what a good question, because I think that is always that sort of a problem is always lurking in the data.
All right, the next question is from Rebecca. Have you noted any significant changes in the alcohol industry or their marketing tactics?
Oops, I'm so sorry. Let me go. Hold on, I'm having some technological difficulties here.
No problem. Take your time.
Yeah. So I don't know how to answer that. I don't study it and I don't track it. I think one obvious change, which is just a change that has occurred in all marketing, is just the move towards social media, more online, digital marketing. So other than that, I don't. In terms of I assume the person is asking about marketing strategies or content. I don't really track that. There are people in the field that do study that. David Jernigan, who's now at, I believe, Boston University, is an expert on that. There are true experts in alcohol and marketing. I'm just not one of them. So I really can't tell you.
Perhaps that's another webinar for us in the future.
I'll watch that one.
The next question comes from Tamara, and the question is, could it be surmised that the decline in youth drinking is due to prevention programs and education? If so, this would be impetus to continue programs. We don't eliminate vaccines because vaccines have eliminated a disease.
Right. I think, well, first of all, I don't think we're anywhere near done addressing this problem, and we need to get the numbers down much lower than they are. Even though they're coming down, it's, if we look at the stats regarding how much young people drink, it's still way too high, and there's still way too much harm involved. And we know that the earlier drinking starts, the greater the likelihood of developing an AUD. So in order to minimize alcohol-related harm among adults in the population, in the workforce, we have to continue to work very hard at addressing alcohol use during the adolescent years. It would be nice to be able to say that these decreases were directly tied to specific things that we've done. I suspect, and other people have asserted, that alcohol-related policies like the minimum legal drinking age and per se limits for driving and zero tolerance for driving for teens, and policies that minimize drinking among adults then trickle down to minimize drinking among kids. So I think there are lots of things that we can point at and say that probably contributed, but we'll never know. We just have to keep plugging away and working at it. Yeah.
The next question comes from Pamela. Do you know the relationship between eating disorders and substance abuse?
Oh, just that there is a relationship. That's really all I can say. Yeah, clearly having an eating disorder increases your likelihood of developing an alcohol or other drug use disorder. Why that is, I don't know. But in general, any condition that somebody has that causes them distress, that causes them anxiety, shame, depression, anhedonia, whatever it happens to be, anything that causes people to feel distress sets them up for negative reinforcement from a drug. And liking the negative reinforcement from a drug, in other words, doing the drug and feeling better, sets you up for developing a problem. Because the brain is wired in a way that when we find something that makes us feel good or makes us feel better, we want to repeat it. That's how we learn. The same circuits that drive substance use are the circuits that drive eating and drinking. and bonding. Substances tap into these pathways and essentially trick us into thinking that we just did something that makes us feel better and it's natural and healthy. So we want to go back. It's just a very natural response to that reinforcement. And so I think any condition, if you look across all, mental health conditions, there's not one where there's a decrease that I know of where there's a decreased likelihood of AUD. Wherever there's misery and discomfort and suffering, you're at greater risk of falling into the trap of drinking or using other drugs to feel better. So that's really as far as I can go. Maybe somebody else has explored this in much more detail and has a better sense of the mechanisms, but I think those are the general mechanisms. People want to feel better, yeah.
Okay, the next question is from Elizabeth. Do you have an explanation for why there has been an increase in alcohol use by women?
That is such an important question, and there are people in the field who have wrestled with that. There's a woman named Catherine Keyes, who I've forgotten where she is. She's one of our leading experts on alcohol and women's drinking. Sharon Wilsnack, who's been doing this for 30 years, looking at women's drinking around the world. And I can tell you that a small part of it is the slow march toward equality, which sometimes seems imperceptible, but we are moving toward more similar roles in society and similar opportunities. Again, I'm not suggesting we're there, but I'm suggesting we're moving toward that. And so some speculation is that the increase in income among women has given them the chance to drink more. I mean, if you have money, you can drink. I mean, that's one simple thing. But I would also assert that stress among women, because it's like 60% of households are headed by women, and women still, even if they're in a two-parent household, do more of the domestic responsibilities. I think stress among women. We're seeing this among teens, but I think among adult women, stress has to be increasing astronomically as well. And so, because as women, so I think it's those are just two examples. I don't think anybody knows for sure, but I think it's, I don't, that's as far as I can go. I don't really know more, but I think it's complicated, and I think maybe it's a combination of opportunity and stress.
Okay, we have a question specific to fetal alcohol spectrum disorders, and to the extent that you have any information on, how the increase in women's consumption impacts that issue.
Yep, I think we're still waiting to see that. I have a whole bunch of stats that I'd be happy to send about the prevalence of drinking during pregnancy and FASD, but off the top of my head, I don't know if there are any data yet that have tied these increases in women's drinking to an increase in exposure to alcohol in the womb. But again, if that person would like to contact me offline, I would be more than happy to send everything I have.
Okay, and there are a couple questions that are about what you might deduce are the drivers for this increase in alcohol use among females. Some are asking about product offerings, flavors, strengths in mixed beverages, energy drinks, and others are looking to get more information about perhaps if marketing and advertising are contributing to that issue. So anything that you can speak to that end?
I think, again, the people that actually study that in the field would be the best to go to, but it's tricky because sometimes, marketing can be a driver, and sometimes marketing can follow changes in consumer behavior. And so is it that that women's drinking has, so the nature of the relationship between the marketing and the drinking is complicated to deduce. And again, I don't really follow the changes in advertising. So I would highly recommend reaching out to somebody. And if you want to contact me, I can send you some contact information.
Okay. Alicia has a question. We educate youth a lot regarding substance abuse disorders and alcohol. However, in your experience, have you seen ways to reach adults regarding outreach and prevention?
Yeah, that's very tricky. I think the most important thing to remember with any of this outreach and prevention work is relevance. When something is relevant to people, it tends to have more of an impact. And so, for years, I remember hearing when I first started doing prevention work years ago, people saying, well, information doesn't change behavior. Information doesn't change behavior. And so at a meeting once, I raised my hand and I asked the guy who had said that. I said, if I told you your flight was canceled this afternoon, would you still go to the airport? And he said, well, of course not. And I said, well, I guess then information can change your behavior. It just has to be relevant. So I think we have to keep working at finding ways to connect with adults and make this information relevant to them. And one of them is one way to do that is to talk about kids, if they have kids, that modeling healthy behavior plays a direct role in how kids end up relating to alcohol and those sorts of things. So I think we tend to reach adults more through policies. That's my sense of it. We just sort of establish boundaries, and adults have to function within those hours of operation, taxes, things like that. And I think we tend to do more education and outreach for kids because we can reach them. They're in schools. So I don't know of any. I'm trying to think of a prevention program aimed just at adults that has worked the way that some of the programs with kids do. Oh, well, I can tell you, programs that include both parents and kids end up working for both the parents and the kids. So you look at something like the what's now called the Strengthening Families Program. It used to be called the Iowa Strengthening Family Program. This is a program where parents and kids go to a weekly group meeting for, I don't know, 10 weeks or so, and learn all kinds of stuff, and that ends up reducing, and they learn things about communication between the parents and the kids. That ends up reducing alcohol use among the kids and the parents. But other than that, I don't have any. I'm probably missing something, but that's all I can think of.
Okay. So Pamela has a question. Since opioids are prescribed by doctors, do they routinely warn about using alcohol at the same time?
I suspect they do now more. I don't know of any data on how prevalent that actually is or was. I mean, it's on the container, but how often people pay attention. Pharmacists also are in a position to tell patients. How often that happens, I don't know. So it's something we really need to make sure people know, and it might be good to think of ways to reach more physicians about that, to ensure that they tell their parents. We do some things here to draw attention to stuff like that. We've published a few papers over the last few years about alcohol and medication interactions and how many adults take medications that could interact. And but whether that's had an impact on consumer knowledge and physician behavior, I really don't know. But it's absolutely imperative that people understand you do not need much alcohol. I'll give you another example, benzodiazepines. There's been an increase in deaths from benzodiazepine overdoses like Valium and related drugs like Xanax. It's very hard to die from an overdose on a benzodiazepine, but not if you have a little alcohol. And so, again, these drugs combined with alcohol are very dangerous. And so I don't know how many physicians do talk to their patients about it, but it's obviously something that is very, very important to do.
And I would just add that I believe CDC has developed some resources to encourage, coalitions and others who might be interacting with physicians and pharmacists to encourage that conversation to happen. So there are resources out there to help if you're looking to implement that in your community.
Oh,
and this will be our final question. Do you know if CBD has an effect on the alcohol effects of the body?
I'm still a CBD skeptic, so I don't know of anything around alcohol and CBD interactions. I know that CBD. I've seen published evidence that CBD is valuable for some things. Obviously, childhood epilepsy, because that's been approved by the FDA, and it does seem to work for some people for certain things. I haven't seen anything about its interactions with alcohol. You know, I'm taking a wait and see approach, and hopefully maybe somebody will figure out that it is the best cure for alcohol use disorder. And then I'll be a believer.
To be determined, right?
Yes.
So that will conclude this webinar. I do want to address one housekeeping question that was asked. Dr. White, are people able to utilize your PowerPoint information without any copyright infringement?
Absolutely, as long as it's not for profit. So if it's for an organization or your own presentations or to educate people, in fact, I will happily send you 100 more slides. I mean, I'd be grateful if you use them. I mean, we do this kind of work just to help people understand alcohol and its potential health impacts. And so I'd be delighted if you used it. So yes, please.
Well, and we will also have this webinar available on our website under the resources tab in the next 7 to 10 business days, as we mentioned at the front end of the webinar. So with that, I'm going to just thank you, Dr. White, for your time and for sharing your valuable knowledge with us. And thank you all for joining NABCA on this webinar. If anyone has questions that we did not address or thinks of something afterwards, feel free to email communications@nabca.org. Also, please visit the NABCA website at nabca.org for various resources, including white papers, previous webinars, and other materials. We would like your feedback about this session, and we'll soon be sending you a quick survey to complete. And also let me know if you have any suggestions for future webinars. It is our goal to give you the education and tools you need to perform your function effectively. Wishing everyone a great day, and thank you. Have a great one. Bye-bye.
Thanks, everybody.